Well, a Supreme Court ruling today has paved the way for states like Idaho to remove Planned Parenthood affiliates from their Medicaid programs. The case in question comes from South Carolina. And in a 6-3 vote, justices ruled while Medicaid rules do allow people to choose their own provider, that does not make it a right enforceable in court. So let's bring Joe Paris in now. So how does this impact Idaho? Because I know there are rules already in place with regard to this in Idaho.
Yes, and while this ruling for the Supreme Court doesn't actually do anything immediately today, it does kind of put the clear writing on the wall about what could happen in the gem state as we move forward. So the decision today, it's not technically an abortion ruling, but guilt by association. It does fall in line with the conservative push across the United States to defund Planned Parenthood of all public dollars. So this is an opt-in decision, meaning places like Idaho could soon pass laws that would basically make Planned Parenthood ineligible for Medicaid reimbursement. Abortion in public funds, and really that whole conversation, it's already illegal in the state of Idaho. Planned Parenthood locally worries that care will be compromised if Idaho does continue down this path to cut off Medicaid reimbursement.
The care we're talking about is life-saving cancer screenings, STI testing and treatment, family planning, annual, PAP tests. Abortion is already banned in Idaho, and Medicaid dollars never paid for abortions in Idaho. We are talking about life-saving preventive care. And we are calling on Idaho lawmakers, frankly, to do what's best for their constituents in Idaho.
Planned Parenthood sees this as a potential health crisis. The nonprofit is calling on Idaho lawmakers to fully understand what they do and who they serve.
Our health center in Meridian, nearly 40% of our patients are at or below the federal poverty line. And for many of them, Planned Parenthood is the only provider they see all year long. Those patients who already face barriers to care, whether it's because they are low income or people of color who have historically already faced a multitude of barriers to accessing health care.
So if the state of Idaho does pass a law next session to prevent Medicaid reimbursement to Planned Parenthood, Medicaid patients will basically have two options. They can pay out of pocket and continue their care, or they can try and find a different provider for that type of care. So the challenge, though, according to reproductive health advocates, qualified health centers would have to increase their contraceptive services by almost 60% and their STI care by 352% just to keep up with the existing need, something that could lead to coverage gaps. And Brian, we talked about the big, beautiful bill, the reconciliation bill. That is also relevant to this conversation because there is a provision in there that says federal dollars would be prohibited from going to state Medicaid funds for providers that do abortions. So even if a state like Idaho didn't change their law, that would still have an implication here.
But that already applies to Idaho.
Correct.
So that's not a thing. But with all this discussion of Medicaid, even this past session, is there any indication that next session some of these House and Senate leaders are going to try to introduce these changes?
I think that there's certainly reason to believe they would. We have heard Idaho lawmakers at the state level and the congressional level kind of refer to Planned Parenthood not as a health care provider, but as an abortion provider.
Strictly, right.
Strictly. So even though in the state of Idaho there is no abortions allowed through a service like Planned Parenthood, unless there's a very narrow exception, as we've talked about, they still see Planned Parenthood nationwide as an abortion provider. Therefore, they don't want to see any federal dollars going to that type of organization.
It sounds like this is a whole baby out with the bathwater kind of things, the chainsaw versus the scalpel when it comes to making these cuts.
And that's one of the criticisms of this entire, process. But then again, it's a fundamental, disagreement between those that see these types of healthcare services as within the realm of all healthcare services.
Right.
Others see it as just an abortion provider, and they say, well, you can go get this healthcare somewhere else. So we will see what the appetite is at Idaho State House coming up, probably leading into January.
They seem to have a pretty strong one when it comes to Medicaid.
They really do.
All right. Well, thanks, Joe.